COVID-19 pandemic has turned the world on its head. Many borders were closed, public gatherings have been restricted, and many of us have been required to hide out in self-isolation or quarantine. We have been repeatedly told to wash our hands, and other restrictions have locked us down. As we prepare to return from this to the new normal, there will be confusion. Questions will emerge about how to protect ourselves from infection. How do people working on the front line protect themselves as more businesses prepare to reopen? How do we make sure our workplaces are clean and have been disinfected? What about the air quality? Have the HVAC systems been impacted? And how do ordinary employees make sure they are safe to return to work? How do we talk to our employees about the risks and the appropriateness of controls? My name is Glyn Jones. I'm an industrial hygienist, a safety consultant, and a partner at EHSP Partnerships Limited. In the next few weeks, we'll be releasing a series of webinars that we hope will be helpful to health and safety practitioners and business owners as we all get ready to get back to work in the new normal. These webinars will cover topics on returning to healthy workplaces with a focus on integrated worker health. For this video, I want to discuss the idea that part of our success in the new normal will require a focus on integrated worker health. I'm going to talk about what it is and why now is the right time to change our focus in this way. Occupational health and safety practitioners have an important role to play in providing the support and leadership needed to get us all back to work safely. As safety leaders, we play a key role in driving positive change within our organizations. This restart of work in the midst of the COVID pandemic will require collaboration between occupational health and safety professionals, human resources, and the operations team. For this restart, things are going to be different. Things need to be different. Some people will be fearful. Our mental health may suffer. We all need to be ready to adjust expectations. Productivity may change. The rules about travel will be very different. In fact, our work culture and everything about work has to evolve. That includes how we approach occupational health and safety. In my view, what's needed is a more collaborative and holistic approach to ensure worker health and safety as we move back to work in the midst of this pandemic. The traditional transactional approach to safety, where the focus is on the system and its parts, will not be enough. A novel approach will be needed for the post-COVID Canadian workplace if progress is to be made, if the reopening is to be completed safely, and if the pandemic is to be slowed. The idea of focusing on the whole worker is needed. Although this idea is not new in North America, it is timely. Back in 2008, the U.S. Commission on Health and Safety and Workers' Compensation developed a guideline document called The Whole Worker. It gives guidance on integrating occupational health and safety and workplace wellness programs and provides an appropriate framework to guide us through the remainder of this pandemic. It might best be described as a framework for integrated worker health. Health is one of the most important yet complex issues facing organizations today. The workplace has a significant influence on worker health, both in terms of job conditions that may threaten or protect workers' health and safety, and how our jobs promote or interfere with individual wellness. Traditionally, occupational health and safety professionals have developed and supported focused programming that primarily concentrated on ensuring workers are protected from the harms that arise from the work itself. As we prepare for the new normal, the focus will have to include more integrated programming that considers the risks associated with exposure to the virus and the hugely expanded programs of control necessary to prevent infection and the spread of the disease. Under this new integrated system of planning and care, the policies, programs, practices that integrate protection from work-related health and safety hazards will need to be different. A new focus on health promotion and illness prevention will be required to advance worker well-being. A renewed focus on all aspects of the hierarchy of controls will be required, ensuring that we take full advantage of engineering controls, worker education and training, cleaning, disinfection, and decontamination procedures and other administrative controls. And of course, there will be a need to integrate the use of personal protective equipment. It's increasingly obvious that work is one of the more important social determinants of health. Integrated worker health acknowledges this and builds on it. There are many job-related factors affecting risks to workers' health. And these include things like the rate of pay, the shift length and schedule, the physical and mental workload, the resulting stress levels, interactions between workers, supervisors, and the public, access to paid leave, and a wide range of other health-promoting activities that can all impact workers' total health. It's well recognized that workplaces can have an important impact on the well-being of workers, their families, and the communities they serve. During this time of the restart of business, amidst the COVID pandemic, integration of worker health will be needed with renewed focus on these four pillars: physical health, provision of health risk assessment, health screening, and other things like biometrics and medical assessment and lifestyle. A mental health, general mental health, development of coping skills and resilience, management of anxiety and depression, and prevention of burnout. The work itself, perceived stress, altered productivities, altered work experience, changes in engagement, the management of the risk of disease, infection, and workplace injury. And then life itself, financial security, new pressures and relationships, and managing the return to work-life integration. The idea of integrating employee health programming alongside or integrated with existing occupational health and safety programming is relatively new in Canada. Increasingly, the safety community will need to work with business leaders to make worker health a priority. This will have to involve the integration of workplace interventions that protect safety and health with activities that advance the overall well-being of workers, establishing policies, programs, and practices within the workforce that focus on advancing the health, safety, and well-being of all employees may be helpful for individuals, their families, communities, employers, and the economy in general. This may be just what we need to get through this pandemic together. Seeking to integrate worker health can yield great benefits for employees. Integrated worker health explores opportunities to protect workers from hazards and advance their health and well-being by targeting the conditions of work. Many occupational health and safety practitioners have long worked to identify and manage workplace risk factors. However, with integrated worker health, safety specialists are also asked to consider factors previously ignored because they were thought to be unrelated to work. In the return to work during the COVID pandemic, employees and employers will need to think about health not just while at work, but wherever they are and at all times of day. Side effects of the COVID pandemic have included issues such as sleep disorders, increased risks related to cardiovascular disease, anxiety and depression, abnormal eating patterns and associated weight fluctuations. We often refer to this as the COVID-19 pounds of extra weight. And there have been other health conditions as well. These too are now factors to be managed as part of the programming we need to successfully bring everyone back to work. Implementing a more integrated approach will include both environmental and organizational factors that need to enhance employee health. There remain some big challenges ahead as we prepare for the slow restart of our economy. A more holistic approach to employee health and safety in Canada will be a big help in ensuring that the restart happens properly and employees remain safe and healthy. What is needed is an integrated approach and an effort by all occupational health and safety professionals to work with human resource professionals and the business leaders to put in the extra effort, start the conversation, and continue to work hard to increase the momentum of the total restart of the Canadian workplace. I hope you'll join us for the rest of the webinar series, where we'll start to unpackage this complex subject and hopefully help you to help your organization to get ready to get your people back to work.